The Rich Hospital in Accra has signed an MOU with the World Spine Care Organization to establish a special spine clinic in Ghana. The move is part of efforts to upgrading the hospital into a teaching facility. My guest in the studio tonight will help us to understand exactly what this is all about. And to my left is Dr. Adjei Kwayisi, spine specialist at the Rich Hospital. And then to my extreme left is Dr. Jeff Outerbridge of the World Spine Organization. Gentlemen, lady, welcome to the studio.
Thank you for having us.
Let's start from here. So the spine, let me start with Dr. Kwayisi. The spine, very key to the human body. But how good have we taken care of this particular feature of the human body?
Okay, in actual fact, if you think about it, we have only one spine in our bodies, whereby we have the nervous system basically running through it. And it's through these nerves that we have, you know, information going to even your eyes, your hands, and everything that you do with your daily living and even living on earth. Somehow, it's one of the least aspects of healthcare that we have in our medical system.
About it.
We don't really
think
talk about
it.
Yes. Because somehow we usually have their cases such as malaria and HIV to deal with. But somehow it's a problem we need to deal with actually, because when you think about it, spinal health causes a lot of disability worldwide. I mean, with the WHO research that actually came out in 2010, it was one of the leading causes of disability worldwide. And it's something that needs tackling. And we lack more of an evidence-based sort of care in our healthcare system model in Ghana presently, and that's what actually spurred us on.
Let me speak to Dr. Outerbridge. So you are in Ghana to perhaps take a look at how to help us deal with our spine. But why precisely Ghana? Is the reason why your organization decided to choose Ghana?
Actually, because of Dr. Adjei Kwayisi. She has returned from training in the United States and is a medical doctor and a chiropractor. And so she has a real specialty in spine. And she recognized that in order to develop a good spine care program in Ghana, it needed to be evidence-based, it needed to be sustainable, it needed to be interprofessional. And so she eventually found out about World Spine Care, and that's exactly what we do, is we help developing countries, and we say underserved regions, so it's not just developing countries, but even developed countries that don't have access to spine care. We help them develop models that are evidence-based and interprofessional and sustainable. So it was really on her invitation that we came here to help her establish what she saw as sort of the best model for dealing with spinal disorders.
Dr. Kwayisi, so the Rich Hospital, how key is the center having this facility for patients?
Well, if you think about it, Rich Hospital is situated right in the middle of Accra, and it's accessed by all, you know, those in higher status and those who are from a low-income status. And actually, it's the best one, I would say, that will be able to reach out to most people. But we are not limiting it only to Rich Hospital.
Right.
We intend using this model, building on it. That's part of the sustainability model. And then replicating such clinics in other facilities in Accra and even outside Accra to other regions. So it will just be more accessible wherever possible in Ghana.
I'll come back to talk more about the model that you want to establish at the Rich Clinic. But let me go to Dr. Outerbridge. So what is the collaboration with the World Spine Organization, with our local doctors here, in training them, getting them to also train more local doctors?
So what we're really bringing is more of a toolkit.
Right.
So we're bringing documentation procedures, data collection procedures, community education programs and stuff like that have been established by the larger spine, the greater spine community around the world. Our organization is a collaboration with spine experts from all stakeholders in spine from all over the world. And we've come together to put together sort of ideal models of care. And so from that, we've created a toolkit. And really what we're bringing to Ghana is the toolkit that is based on this sort of evidence-based model.
And so, for instance, she talks about getting into the community. The World Spine Organization, what role do you play in that?
We really, again, giving Dr. Adjei Kwayisi the tools to do that herself. Right. And so we're not really involved in the on-the-ground dissemination of the information, but we provide the information for Dr. Adjei Kwayisi to disseminate it to the community, because obviously her being from Ghana is much more effective at disseminating education to your community than I would be.
Exactly, I know that. But Dr. Kwayisi, so let's talk about the models that you want to help establish at Ridge and perhaps expand into the rest of the country.
Yes, it's basically based on evidence-based information.
Explain that.
Yes, so what it means is research has been done in various areas. With the model that we are using right now, it's more of a conservative approach to spinal disorders, using exercise, spinal manipulation, manual therapy, rehabilitation therapies, and all these are based off research that's been done and proven to bring the best outcome in clinical care when it deals with spinal disorders. Basically, that's what we are doing.
That's what you're doing. And you talk about getting to the communities. How is that? And which form is it going to take?
Okay, that is something that we have in the MOU signed with Ghana Health Service, where there will be more of a collaboration in helping people who are really interested to go out there to study into more of the tools that we are using now in Ridge Hospital, and then they would come in, would work and partner and find out which areas need spinal clinics, and then they will probably move into those areas. So it's something that we are really working on now, but it's really feasible and something that we're really
So it's a matter of you getting to health centers or polyclinics down there to make them become part of the process.
Yes, they can become part of the process, but I'm just one person.
Okay, so you need more.
So
perhaps Dr. Outerbridge should think about more support for our local doctors.
They have something of that sort in the MOU. We don't have permission to disclose that now.
All right. Gentlemen and lady, I'm grateful for your time tonight.
Thank you.
And we're sure we'll be a part of the process and see how it goes.
Yes.
Thanks so much for coming.
Thank you very much.
Right. Dr. Outerbridge is with the World Spine Organization. And Dr. Adjei Kwayisi is a spine specialist at the Ridge Hospital.